Guys, so my name is David, and I'm going to go over my patient-centered care presentation. So, for my topic, I got patient education self-care programs. So, patient education programs, what are they? So, a patient education program is a program that consists of data information on cardiac physiology, anatomy, risk factors for cardio heart failure, diagnosis and symptoms, disease management, exercise and diet, medications and their side effects, as well as blood pressure monitoring. So these are a couple of factors here that do affect uh, self-management of, you know, the patient. You know, what factors, tie into it. Their surrounding factors, people, um, this is where patient education is really important because it can enhance what a patient knows about their health and how they can handle it in the future. And then of course over here in letter B, we do have a couple of components of educational programs. So advice on exercise, because exercising can improve your health, cognitive behavioral elements, multidisciplinary pulmonary rehabilitation programs. So, that has to do with, your heart, ongoing clinician and nurse support, and then optimization of care plans. So, plan of action, how are we going to assess and implement a proper plan to improve your health? Okay, so next we have research evidence. So, how strong is your data? Is it supported? You know, people want the best data on their health, so that way they can improve their health. They want to know, that the information that you're telling them is correct, and these programs are solid in terms of base and foundation. So evidence of impact. So if your evidence is strong, it's going to impact someone's health. It's going to improve health disparity, and then of course, it's going to economically improve, a patient, less money out of their pocket. They're getting hurt less in terms of athletic training, less disease. And of course, if a clinic is really sound in self-care patient education programs, they're going to get referred a lot. So that's going to improve, the employer as well as, the employee. Everyone's going to make more money, basically. So a couple of research, evidence. So there was a randomized clinical trial published by Doris. It was a huge impact that was found on effectiveness and cost effectiveness in an empowerment-based self-care education program on health outcomes in patients with heart failure. So, this was a really good clinical trial that was conducted. And then self-care education programs have been directly connected with positive cardiovascular results. So lowered blood pressure, increased hypertension related knowledge, and then enhanced competence in hypertension and self-management behaviors. So they're able to make better decisions in terms of cardiovascular health. Self-care education programs have been proven to increase medication adherence, self-efficacy, rated health, cognitive symptom management, frequency of aerobic exercise, and depression through numerous researches. So it's going to help you, improve your levels of health as well as your happiness, because I know depression does have to do with health as well. If you're not healthy, you're not feeling well, you're not going to be, in the best mood. Exercise as well. You're going to exercise more frequently, which in turn is going to increase your health. Also, cognitive. You're mentally going to be sound. You're going to be able to function a little bit more efficiently. Also, in terms of health model estimates, but not actual cost data, it has been estimated that health systems could possibly save $3.9 billion nationally. So this would come into effect if 5% of adults with one or more chronic conditions were educated on self-management from a particular program. So basically, this is a theory which is backed by a lot of evidence. So this is how much money healthcare systems all around, everywhere could save in total, $3.9 billion. Again, it's not an actual estimate, but it's like a general model. Also, in terms of minorities, African and African American, well, ethnicity, African American and white Americans both have been positively affected by self-care education programs through various studies as well. But there still needs to be more research on other ethnicities as well. So, not just African Americans and white Americans, and also different ethnic populations, and then different income populations, especially low income populations, because that would be a really good focus for the healthcare system. A lot of people don't have money, don't have the proper healthcare to seek, help. Some people are scared to go to the doctor because, they're afraid they're going to get, charged. If you're educated on your health, you have all these options of different programs you can go to. Okay, so now we have examples in healthcare. So patient self-care education, there's been, an instance where it was implemented in healthcare facilities, according to the Journal of the American College of Surgeons. So this is an example of a program that was being implemented, and patients were trying to transition patients from whatever it is that they were accustomed to transitioning into this education program. So it was kind of like a study. So they had a control group, which was patients who had no education program, self-care education program, versus the ones that were being given an education program, and then the effects were compared, and they did have a positive outcome in terms of self-care education programs. Another one would be patient self-care education and support has been applied to other clinical settings in a community, such as the YMCA, the federal qualified health centers, and managed care health systems. So these are, a couple of different settings where it has been applied. And then, of course, patient self-care education programs were introduced to women diagnosed with breast cancer-related lymphedema by physical therapy specialists and physiotherapists. So they wanted to reduce risk factors and apply self-care to patients post-surgery. So people that, haven't had it yet, but have some risk factors, and then apply to people who've already had the diagnosis, already went through surgery, in order to, maybe alleviate certain symptoms or post effects as well. Clinical implementation. So this is just a little diagram of different factors of clinical implementation in terms of self-care, so self-management, self-testing, and then self-awareness. The three basic factors that come into play for an individual, and this can be improved by implementing self-care education programs. Okay, so the biggest thing I would say on self-care implementation, as far as the self-care education programs, would be resources. So health department agencies can refer patients to self-care management programs. So, referring people to certain programs that can educate them, can help them out. The CDC also has tool resources designed to assist patients for self-management care educational programs in specific communities. So this is in the US. One resource would be called Learn More, Feel Better. Again, these healthcare implementations, can involve athletic training as well. I know there's a few programs that do involve that also. According to the National Association of Athletic Training, or NATA.org, athletic trainers should teach patients and implement self-care education daily. They should connect them with programs, again, with resources and assistance. If they're educated properly, if they're given these self-education programs, then they're going to have, again, better patient outcomes than without any education. They're going to prevent people from getting injured in the future, and also prevent re-injury from people that have had a past history of injury as well. And then again, it's going to have an economic benefit for the patient as well as the employer, because it's a return on investment. If you have a good program that's sound and educates your patient, then there's going to be a lot less injury or disease that could have been prevented. There's always going to be injury and disease, but there are some instances where there can be a lot of factors that could prevent it as well. So again, the goal of the clinic is to provide a source of health awareness, so you're aware of what causes certain diseases, certain injuries, and then we have a patient make better health decisions. So if you know how to avoid certain injuries or diseases, you're going to be able to make better decisions, taking certain medications, involving yourself in certain exercises to improve yourself, prevent disease in the future. And that's it. That's it's just my bibliography and my cited sources.